I was riding my bike in Palo Alto, and I got hit by a car. I actually have no memory of any of this because I had a concussion, but I woke up in the emergency department at Stanford Healthcare, and it's interesting the things that you specifically remember. I remember staring at the ceiling tiles as you're being rolled down the gurney down the hallway, all the different dots. That's a specific thing that I remember. And they told me they're going to put you into a CT scan to see whether you have any broken bones. You've been in a car accident, and I felt fine. And for whatever reason, I was pretty lucid at the moment. So I went to the CT scan, came out, and they said, "Good news, you don't have any major broken bones. You're going to be okay." And I remember my wife and my kids were there as well. I couldn't really move my head much because you're in this big neck brace. So you kind of have these voices off to the side telling you things. They said, but we did notice something else though on the scan, which is it looks like there's some sort of mass in your kidney. And I was very confused by that. And it turns out the next day I had an ultrasound, and after I had an MRI. It turns out that I had stage 1 kidney cancer and had no idea. And there is no way of knowing when you have stage 1 kidney cancer that you have this. There's no symptoms. There's no way that you would have any idea that this ticking time bomb is sitting there. By the time you typically do have symptoms, it's typically stage 4. And the difference in survival is dramatic. So at stage 1, 95% chance of survival. At stage 4, 5% chance of survival. So pretty dramatic. So I like to say that getting hit by a car literally saved my life, to be clear. And that makes you also step back and think, are you spending your time on this earth on the most important thing to you? And that time of period between when you've been diagnosed and when you have your treatment makes you spend a lot of time with that question. And I was thinking about the fact of, do I really want to spend my life helping people click on ads and buy apps? Is that really the most important thing for me? As great as it is. And I came to the conclusion, no, what I wanted was to work on things that would give people the experience that I had, where we didn't have to hit people with cars in order to be able to change the way that their lives were going in terms of health. How can we do more that way? So that's kind of what got me into healthcare.